Define for me comparative effectiveness.
It's a pretty logical term, except in the world of healthcare. But what it means in healthcare is that you have a bunch of doctors, of panels, peer groups,
right,
who study. Let's say there's cancer drug A and cancer drug B. Cancer drug A is $10,000 a dose. Cancer drug B is $1,000 a dose. People suspect that they might be equally effective, and in fact, people suspect that cancer drug B, the cheaper one, might actually be more effective.
Because?
Because it's just a better drug. It's a different drug. It works better on this cancer. So what comparative effectiveness does is it says, let's study the outcomes when you give patients B versus A. So far, so good. All logical, right? Congress has prohibited Medicare from then saying, okay, we've just figured out that the $1,000 drug is actually more effective than the $10,000 drug, or the same. Therefore, we're only going to pay for the $1,000 drug. We didn't decide this. Peer groups of doctors did exhaustive research. We're only going to pay for the $1,000 drug, not the $10,000 drug. Congress won't let Medicare do that. Guess why? You think the military-industrial complex is big in Washington? The healthcare industry spends 4 times as much lobbying.
So more than defense contractors, healthcare companies spend a lot more to lobby the Congress than do defense contractors.
Exactly. Yeah. You open any Washington-based magazine like National Journal, Politico, and it's filled with ads from healthcare companies urging Congress to spend money on this or not to curtail this program and not to pass a regulation allowing, for example, for comparative effectiveness.
One simple explanation, one simple observation of Obamacare is that, and the President likes that term, by the way. He didn't in the beginning.
He embraced it.
Embraced it, exactly. Is this notion that what they got right was access, but got nothing right about cost containment?
That's exactly right. And access is a good thing. And it is a historic breakthrough that people, many more people will have insurance, not everyone. That's terrific. But step back and think about it. What they got access to was the ability for someone, in most cases the government through subsidizing insurance premiums, for someone to buy the health care products that the pharmaceutical companies and the hospitals and the CAT scan makers want to sell. That's why Obamacare passed, because it was good for everybody except the taxpayers.
Take a look at this. This again is Michael Porter talking about Obamacare. Here it is.
It was fundamentally the reform of the insurance system, and many of the reforms were good, and so we need to give full credit there. But it was not, didn't go far enough in really thinking about how we were going to restructure the delivery of care and how we were going to create primary care structures that were also able to prevent disease, because one of the problems we have in healthcare is we've got a lot of preventable things that are really driving the cost up at a very high rate. And we haven't cracked the code of how to do that. The best work on prevention now is actually in the corporate sector. Companies understand that if their employees are sick, don't show up for work, and get expensive illness, that's really expensive to the company. So despite the rhetoric I hear sometimes, thank God the employers are still in the healthcare system, right, because the most progress we're making on health and wellness is actually in employers.
You agree with that?
He's a little bit wrong. Okay. There are important aspects of Obamacare that do go to preventive care. For example, you and I are entitled to a colonoscopy without a copay or a deductible.
Right.
Women are entitled, to various tests without a copay. So there is some element of subsidy for preventive care. Where he's completely right, though, is it's simply shifting, if you will, the deck chairs on the Titanic, and it doesn't deal with pricing. And if anything, it's going to cost more because you're going to create these insurance exchanges, which sound like a great thing.
Yeah.
But what did I say before? One of the big problems is that hospitals are consolidating, they're buying up practices and becoming so dominant in a community that even the 2 or 3 insurance companies that now might dominate that region can't really have any leverage against the big hospital. If you suddenly have 10 insurance companies dividing up market share in that region, the hospital is just going to mow over all of them. So that's what I worry about. Rick
Stengel, the managing editor of Time magazine, said that this piece is resolutely non-ideological.
Right.
But was there an argument to be made by Republicans during the debate over health care that either they didn't make, or because of whatever fundamentalist principles they had that they thought it violated, or because everybody got lost in sort of the shorthand of
well, I mean, I remember
reform care?
Some. I wasn't as attentive then as I am now to this, but you know, I remember the Republicans arguing that this put the government deeply into health care. They were going to control your health care.
And there's nothing of that. All that.
Yeah, there's nothing like that in Obamacare. And again, it has several good things. For example, I describe how hospitals, you know, how hospital bill collectors done these
somewhat argumentative insurance in that case as an issue that has to do with the government. The government's saying you have to have insurance.
Right. Exactly right. No, you're right about that. I stand corrected. But as a general matter, the government's not you know, the rhetoric I heard was the government's going to get between you and your doctor. There's nothing that does that. But what Obamacare does do, it curbs the bill collecting activities of hospitals, although the American Hospital Association is fighting those regulations. It does a lot of good things at the edges, but it doesn't attack the fundamental problem, which is everything costs too much. And the only way to deal with that is not through the free market, but by acknowledging that there can never be a free market for health care. You can't have it. It's not possible, because the buyer can never have the same leverage and the same power as the seller. Is
there any significance in the Congressional Budget Office report earlier this month that a sharp and surprisingly persistent slowdown in the growth of health care cost is helping to narrow the federal deficit? Is that a one-time only thing, or is there a significant trend here that we ought to take notice of?
That's because, again, Medicare, not what you and I pay in health care through our insurance premiums or deductibles. Medicare, there are some reforms, not enough, in Medicare that cut the cost that Medicare pays. Also, the economy has not been as good. You know, this is going back a year, two, or three. Right. But the inexorable trend, unless we do something, is obvious. This healthcare economy is going to eat us alive. I mean, it's almost as if, Charlie, we've been living in two worlds. In our world, in everybody's world, except the healthcare world, the economy's actually not been so great, in case you haven't noticed, in the last decade, or certainly the last 5 or 6 years. The economy hasn't been so great. There are issues with employment, issues with income security, all this stuff that we've all lived through. Then there's this other world in the United States called the healthcare economy, where everything has been booming. The jobs keep growing, incomes keep going up.
Bitter Pill by Stephen Brill.